Welcome, my dear friends. Myself, Professor Dr. Rajendra Raghuveer Deshpande from Pune, Maharashtra State, India, would like to welcome you all in this session, in this study class of the Charak Uttarardha. Today, we are going to discuss about some topics from the Charak Siddhi. I think everybody knows. Please open your notebook. Come on, open your notebook. Put the date, 3rd of December 2023. Please write down the topic, Charaka Samhita Siddhisthana. We are discussing about Siddhisthana. And today we would like to go for chapter number 8 and chapter number 9. Of course, like a trailer of the cinema. Chapter number 8 and chapter number 9. Because I am expecting that each and every student must check the previous question papers of their respective universities and start writing question and answer in a manner in a separate notebook. Intermittently, you can send me those particular notes that you are preparing to me WhatsApp 922681060, and also you can write to your comments if you find any question difficult. So tell or discuss this particular question specifically, then of course I am going to discuss those points as well as the time permits. Charaka Uttarardha is composed of 3 sthanas, 3. So kindly write down the sthana: Chikitsa sthana, Kalpa sthana, and Siddhi sthana. Charaka Samhita Uttarardha contains Chikitsa sthan, 30 chapters. Oh my God, 30 maximum. Now Kalpa sthana, they are having the how many chapters? Do you remember? Yes, that is total 12 chapters, Kalpasthana, where we are getting the knowledge about the plants or the foodstuff that are useful for the process of vamana, therapeutic vomiting, or purgation, that is virechana. That is information about the medicines used for vamana, used for virechana in Kalpasthana. And in the Siddhisthana, basically related with complications. Panchakarma, Vyapad, Vaman Vyapad, Virechan Vyapad, etc. etc. Now, with your kind permission, let us revise at least the names of the Adhyaya. Kalpasthana, first 6 chapters for medicines for Vamana. Number 1, Madana Kalpa Adhyaya. Madana Kalpa is the best medicine for Vamana. Second chapter, where I am talking Kalpasthan, not Siddhi. Second, Jimutaka Kalpa, in Marathi, Sanskrit, Devadangri, Jimutaka. Number 3, Ikshvaku Kalpa, Kadu Dudhi Bhopala, in Marathi. Gourd, bitter gourd. Ikshvaku, third, Vamana, Ikshvaku, Vamana. Dhamargava, that is Kadu Ghosala in Marathi, Dhamargava, Vamana, Dhamargava Kalpa Vamana. 5th chapter, Vatsaka Kalpa, Vatsaka Kuda, Vatsaka Vamana, Vatsaka Kalpa Vamana. Krutavedhana Kalpa, Kadu Dodaka in Marathi. Krutavedhana for Vamana. 6th chapter finished, names, only names. Remaining 6. Chapter 7, Shama Trivrut Kalpa. Trivrut means Nishottar. Trivrut, Nishottar. Shama Trivrut Kalpa for Virechana. Chapter 8, Kalpasthan, Chaturangula Kalpa. Chaturangula, that is Bahava or Aragvada for Virechana. Chapter 9, Tilvak. Tilvak means Lodra. Tilvak means Lodra for Virechana. Chapter 10, Sudha Kalpa. Sudha Kalpa, that is Snuhi. Snuhi for Virechana, very strong Virechana. Chapter 11, Kalpasthan, Saptala Shankhini Kalpa. Saptala Shankhini Kalpa for Virechana. Chapter 12, Danti Dravanti Kalpa. Various recipes. Kalpa means recipes. Danti Dravanti Kalpa for Virechana. Now I am telling you the chapters from Siddhisthan, correct? How many chapters are there? Also 12. Kalpasthan 12, Siddhisthan 12, Chikitsasthan 30. Are you getting the mathematics? Okay. Siddhisthan for Vyapad basically. Chapter 1, Kalpana Siddhi. Kalpana Siddhi. Number 2, Panchakarmiya Siddhi. Chapter 3, Basti Sutriya Siddhi. Chapter 4, Sneha Vyapad. Vyapad means complication. Sneha Vyapad Siddhi. Chapter 5, here. Netra Basti Vyapad Siddhi. Chapter 6, Vamana Virechana Vyapad Siddhi. Chapter 7, Basti Vyapad Siddhi. Chapter 8 today. Trailer, only trailer. Prasrita Yogiya Siddhi. Chapter 9, three marmiya. Three important vital organs, marma, Rudaya, Basti, and Shira. Rudaya, heart, Basti, urinary system, bladder, and Mastishka, brain. Three vital organs, marma. So, chapter 9, three marmiya Siddhi. Chapter 10, Basti Siddhi. Chapter 11, veterinary, Pashu Vaidyak. Chapter 11, veterinary, Pashu Vaidyak, Falamatra Siddhi. Falamatra Siddhi. Chapter 12, Uttar Basti Siddhi. Chapter 12, Uttar Basti Siddhi. Okay. Let us start with the chapter 8, Prasruta Yogiya Basti. First, you write down title. Management of conditions with Basti of one prasruta. This word is very important, my dear friend. Here, can you see? Can you see? One prasruta is equal to 2 pala. This is the measurement. Quantification, quantity. Here in this chapter, they have described various Basti, medicated enema, as per the unit, as per the measurement, prasruta. Please write down. This is very important. Cursor, can you see the cursor? One prasrut is equal to 2 pal. At that time, they don't have the milligram, gram, kilogram, no. Milliliter, no. 1 liter, no. Only prasruta pala. Now write down. 2 pala is equal to, please write down, 100 ml. Yes, now I have understood. The students understood. They understand when I say the today's language. So what is one prasruta? 100 ml. Make it in a brain. Paat karun taka, yaad karke rakhna. One prasrut, 100 ml. One prasrut, 100 ml. Don't forget. In the oral, they will ask you, one prasrut. Some people believe that it is 80 ml. So some way they will say, 100? No, it's wrong. Then tell that in some way they say consider as a 80 ml or some consider as a 100 ml. Okay. Now next. Here they have given the name of the Basti as per this name of Prasruta. So I will mark for you and then we will discuss. Of course, here to begin with, I am not going to discuss all these Bastis. If the time permits, I will go afterwards and then I will discuss. But various Basti in Prasruta Pramana. What is Pramana? Is a quantity. One Prasruta have been described for those who are delicate and exhausted due to the work. The people who are delicate. So for example, here are the names of the Bastis and here is the name of the Karmas. What are the benefits? What is the function of that Basti? Can you see? Chatur Prasrutika Basti. How much ml? Chatur means 4. 1 prasrut, 100 ml. So 4 chatur prasrutik, 100 multiplied by 4 is equal to 400 ml. Write down 400 ml Basti. That is chatur prasrutika Basti. What are the content? You make your own notes. That is strengthen the Shukra Dhatu. So very good for those having the infertility problems, adhuspermia problems, Oligospermia problem, no child, no baby after the total marriage of 1 year. They are not getting the child. So one has to erectile dysfunction problem, premature ejaculation problem, any sexual problem, chatur prasrutika basti. Is it clear? Next, panch multiplied by 5, 100 multiplied by 5, 500 ml. This will pacify the vata, increase the strength and luster of the skin. So basically, vata is related with the vata bioenergy, musculoskeletal and neurological problems. So if the patient is having leg pain, back pain, neck pain, arthritis, rheumatism, motor neuron disease, hemiplegia, paralysis, Alzheimer's disease, Parkinson disease, vata, brain, nervous system, then pancha prasrutika basti. Next, pancha tikta, 5 bitter plants, prasrutika basti. Write down, tikta means bitter. Tikta means bitter. And bitter taste, please write down. Bitter taste is blood purifier. What you will write? Blood purifier. Panchatikta. Panchatikta. 5 bitter plants. I am telling you right now. Write down the plants, name of the plants. Very interesting. Bitter is best taste. Bitter is amapachak. Write down. Bitter is amapachak. Remove the toxins, endogenous as well as exogenous. Anti-infective. If it is an indigestion also, ama will be removed. Skin, best. Blood, rakta dhatu, best. Pitta gna. Bitter taste is always pitta gna. Maha sudarshana ghanavati. Don't forget, for fever. You remember the crocin, but you don't remember Maha sudarshana ghanavati or Maha sudarshana kadha. For any type of the fever, this is antipyretic medicine from Ayurveda. Antipyretic, diphoretic, reducing the fever. Maha Sudarshana Ghana Vati. Vati means tablet. Maha Sudarshana Kadha, decoction. Everything is bitter. Bitter. So 5 plants. Please write down the names. Patola. Slowly. Patola. Nimb. Patol, comma. Nimb, comma. Bhu nimb, comma. Rasna, comma. Saptaparna. So how many? 1, 2, 3, 4, 5. 5. 5 plants are there. Okay. You take the kvat, 4 prasruta and add 1 prasruta, mohori kalk, sarshap, mustard in English. MUSTRD, mustard. Our kitchen masala, mustard seeds. Okay, kalk, paste. We give the niruha basti, and that will very helpful to control the diabetes, blood sugar, and also skin diseases like eczema, ringworm infection, psoriasis, etc. Next, Shad Prasrutika Basti. Shad Prasrutika. Shad means 6. Okay. So here also you can have the different plants. Like for example, Vauding is there. Vauding. Vidanga is anti-helminthic, antibacterial. So it is useful for Krimi Rog because it contains Vauding. Write down, Shad Prasrutika. It also contains Shevga. Shevga is also anti-infective. Then Amapachak, Nagarmotha. Nagarmotha is there. And then it is Pimpali Kalka is also mixed. Next, we will go further. Sapta Prasrutika Basti. Sapta Prasrutika Basti. That is for sex desire. Libido. Please write down. Sex desire. It will increase, boost up your interest in the sex. Also Viryavardhak. So which are the plants? Please write down 1 or 2 plants. First is a Kshiravithari. Kshiravithari. I am discussing this one. Sapta Prasrutika. Kshiravithari. Then Vidari Kanda. Very strong. Then honey. Shahad, mud, ghee. And Sugar cane juice, very interesting. Sugar cane juice in Sapta Prasrutika, that is best for Virya Vardhaka. Whenever there is a sperm count is low, oligospermia, azoospermia, give this Sapta Prasrutika Basti. Next, Ashta Prasrutika Basti. Please write down Ashta Prasrutika Basti, which pacify the Vata dosha. Which pacify the Vata dosha. So there are another things that I have also described in this particular chapter. But my dear friends, that I am going to discuss afterwards with you. Right now, I will only go further and try to move on the next page. Slowly and steadily, I will take on this right side and then I will go up to just begin with the next chapter, which is called as a Three Marmiya Siddhi. Will you please write down three marmiya? Management of diseases affecting three vital organs or structures. So which are those? Here you can see. Hrudaya, heart. Shira, brain. Basti, urinary bladder. Or you can say the urinary system, kidney also, kidney. Because some people say Basti as a kidney. Remember. Prana or life resides in all three vital sites. Hence, every effort should be made to protect these three organs, marmas, from external trauma or being diseased by the vitiated dosha. So there should not be nija or agantu vyadhi. Nija means from inside and agantu means from outside. Okay. So here they have discussed the different problems. For example, here you can see, we will discuss about apatantraka. First, at least write down, do not write everything. Only whichever things you see on the screen bold, that only word you write down. And after my lecture, immediately go open your textbook. Every student must purchase at least one textbook of every subject and start writing question and answers of the past question papers. This is my suggestion, always, now and then. Apatantraka or apatanak, only this thing you write down. Here, vata, all these problems are vata, localized in the hrudaya, causing the pain in the chest, head, and temporal region, this one, temporal bone. Convulsive movement of the limbs, like fits. Then loss of consciousness, dyspnea, breathing problem, and makes the body bent like a bow, dhanushakriti, bent like a bow. There is a remission and exacerbation. Sometimes it will go, the symptoms will not be there. That is remission, avegavastha. And sometimes exacerbation, that is vegavastha, based on how much vata is aggravated. So to take out from the unconsciousness, the patient can be given tikshna, pradhamana, nasya. But this is very dangerous. Unskilled person should not try. Common people should not try. Expert doctors in the Ayurvedic hospitals, they sprinkle the powder like vacha, vekhanda, or black paper. They take in the specific, what you can say, the paper streak, and then this is pradhamana. Immediately you have to blow the dry powder in first one nostril and then second nostril. Like this. Blow the fine powder. But that condition is very, very skillful job, because lot of irritation is there, burning is there, because that is a strong stimulus. Pradhamana Nasya is a strong stimulus to the head centers, motor centers and sensory organs. Next, we will go and see and discuss about Tandra. Oh, just a moment. On this page, only this one we have to see. Due to the Tandra, write down Tandra. What is Tandra? Like, for example, I am teaching you intermittently, students. What the Tandra? Write down Tandra. I am doing the action. I am doing action. So my eyelids are closing. Drowsiness, like a sleepiness. Some person is feeling sleepy, and how he will behave, that is called as a Tandra. Due to the various etiology means causes. the aggravated vata also displaces the kapha, carries it to the hridaya and obstructing the chetana srotas. Now, let me clear you one thing. Sometimes, if I consider Ayurvedic whole Bruhata and Lahu, Trai, Samhita, etc., Hridaya word is used for two purposes in Ayurveda. Hridaya word is used for the chest, heart, and also sometimes Hridaya word is used for brain. Sometimes for the heart, sometimes for the brain. Sometimes for the heart, sometimes for the brain. Hridaya word. So when they are talking about obstructing, can you see the cursor here? Chetana srotas, that is a sensory system. Sensory system. Then blocking of the sensory ascending and descending tracts, that can be considered as a tandra. Sorry, I will go with this and then I will try to move on the left side first and then right side. Okay. So diseases which affect the Basti or the urinary bladder, these are all urinary problems. Step by step we will see. Mutraika sad, reddish, yellow and thick urination. Thick word is very important. Okay. Then mutra jathara, retention of urine, and because of that retention, pain in the lower abdomen. That is called as a mutra jathara. Mutra prasad is again can be seen in the urinary calculus, renal calculus, kidney stone. Mutra jathara is many times because of the stricture or the fibrosis, like post gonorrhea, sexually transmitted disease. Mutra krichra, the pronunciation is mutra krichra, difficult and painful urination, which is also called as a dysuria. And this is very common, very common in, write down, UTI, urinary tract infection. We can send the urine sample in the pathological laboratory and you will get a lot of pus cells in the urine microscopic examination. Okay, so this is mutro krichra. Then mutro sang is obstruction, retention of urine and dribbling urination. That may be because of the prostate enlargement. BPH, please write down, benign prostatic hypertrophy. Benign, non-malignant. Benign means non-malignant. Prostatic hypertrophy, BPH, that can cause mutra sang because it gives the pressure on the urethra. Mutra kshaya, less urination, or anuria in the dehydration. Whenever the patient is having doing the fasting beyond limit, then there will not be urine passing. Okay. Mutratit, dribbling micturition, dribbling, drop by drop. This also occurs in the prostate problem. Vata sthila, that is the distension of the lower abdomen or the bladder. Vata basti, vata always neurological, severe pain in the bladder. We will go a little bit down. Okay. I will try how much we can go down. Okay, this much we go down. Next is a Ushnavata, burning urination and reddish yellow urine, also in the urinary tract infection, or sexually transmitted diseases, STD, gonorrhea especially, then there will be urethritis and that can cause the burning urination. Also, chlamydial infection, write down, chlamydia, CHLY, chlamydia infection also cause urethritis and that gives the burning urination. In the summer season, when you drink less water, also you get the burning sensation. Vata kundalika, that is retention of urine, and because of retention you get the pain, stiffness and heaviness locally. Rakta granthi, tumor in the urinary tract. Granthi is always tumor. It may be benign, it may be malignant, without cancer or with cancer. Vidvighat, urine having foul smell like feces. Foul smell, vidvighat. Basti kundala, displacement of the bladder, that is distension. Okay. Now we will go further and we will try to discuss about the Uttara Basti. Uttar Basti, very interesting. Please write down. Uttar Basti is very important in the practice also. Very few people, few Vaidyas, male and female, they can do this Uttar Basti because it is a very skillful job. And most important is a proper sterilization. Hygiene is very important because any infection, if passes through the urethra, it can reach up to the kidney, and then there may be acute pyelonephritis, chronic pyelonephritis, and kidney failure. So be careful when you are doing Uttar Basti. Written consent, attendant, female attendant should be there, everything that must be taken care of. Medicaments given per urethra in the male or per vagina in the females. Or of course in the urethra also male and female both, but per vagina only in the females. It is effective in diseases of the bladder, prolapse of the uterus, that is called as a bhransha. Prolapse means bhransha in Ayurveda. Severe pain in the yoni region, vaginal part, vulva region, menstrual disturbances. In females, Uttar Basti should be 10 angula long. What is angula? Finger unit. Finger unit. In the first year BMS, we had previously practical anguli praman to measure the finger unit. Okay, so you can measure by circumference by vernier caliper. The name of the instrument, vernier caliper. It should be inserted 4 angula with vagina. For example, here 1 angula is 1.2 centimeter. So 4 angula means 1.2 multiplied by 4. Okay, so 4.8 centimeter. 2 angula within the urethra and only 1 angula in young girls. Okay, now I will shift the screen on the right side with your kind permission, and let us move the screen on the right side, and then we will try to go up in the beginning. Okay, let us go up slowly and steadily. I don't feel that this is a wastage of time. This is a nice time because we are discussing systematically. Now, Shankhaka Roga. We are having 3 marmiya there. Shankhaka. What is Shankhaka? Please write down the name. At least you write down every bold thing. Not each word, not each line, only bold. So you can get the points. Okay, this has been discussed. Okay, this has been discussed. Shankhaka. Vitiated rakta, pitta and vata produce the swelling in the temple region with severe pain, burning sensation and redness. It causes the death within 3 days. Very serious disease. Huh? Actually, how much we can compare with the modern, we have to think about it because it is a research oriented point. We are at the moment, I cannot tell you exactly this is equal to this, but I will try to find out what can be compared with the modern emergence. Okay, so here we can give the Shiro Virechana Chikitsa, Parisechana, some sprinkling of some medicines, and Visarpanashaka, erysipelas, because this is Pitta, very hot and heat. So to reduce that heat, one can do Visarpanashaka Chikitsa. Shankhak Rog is supposed to be fatal. Within 3 days, the person can die. Okay. Now we will go further and try to discuss about Ardhava Vedaka Chikitsa. Next disease. Write down only title, Ardhava Vedak. Actually, the name suggests Ardha means half. Only half headache is there. Like, for example, typical bookish picture of migraine. Okay. Aggravated vata independently or along with a kapha causes the severe pain in one half, right or left of the head region, especially over neck, eyebrows, temple, ears, eyes, and forehead. These are the parts where lot of pain is there. The pain is so severe that the patient feels as though his head is being cut into 2 sharp instruments. Cut. Head has been cut. Very severe pain, cutting pain, it is called as a Chikitsa Chatursneha, Ghruta, Taila, Vasa, and Majja. Write down 4 Sneha. Ghruta, ghee. Taila, oil. Vasa, fat, oil. Meat, oil. When you cook the meat, some oily layer is coming up, that is called as a vasa. And majja, bone marrow. Okay. So we can use for Shirovirechana, we can use for Kaya Virechana, we can use this Chatursneha for Nadi Sveda, Prapurana Ghrita for Abhyandara Pana. Pana means oral treatment, or Anuvasana Basti with Ghrita or Niruha Basti, and you can use also Shiro Basti. What is Shiro Basti? Shiro Basti is related with the head. Normal Basti is given through the anorectal region, anorectal root. Okay. So this is Shiro Basti means you have to take a leather cap, and then make a paste of that black gram, and inside you pour the lukewarm oil as per the prakriti or as per the season. Okay. So that is given as a unctuousness, lubricating matter or nourishment to the whole brain cells, and that can reduce the irritation of the brain cells or the vessels. Okay. So that is the purpose of Shirobasti. Then we will go further. Next name is, can you see? Suryavarta Roga. Suryavarta, that is, Roga means disease, Vyadhi. Vitiated Rakta and Vata, vitiate the whole Mastishka brain region, causing pain in the head. This pain is related to the sun. As the day begins, Suryodaya, sunrise, the pain begins. Gradually increase as the day passes. At 12, it will be very, very severe headache, and decreases in the afternoon. When 3 o'clock, 4 o'clock, 5 o'clock, as the sunset is there, headache will also go down. Sunrise, headache will be there. Sunset, headache will go down. Sunrise, sunset. Sunrise, headache will up. Sunset, headache will go down. Are you understanding? Sunrise, sunset? That is Suryavarta. Chikitsa, Uttar Bhakta Ghritapan. Very interesting. Bhakta means mammam. Taking meal, food, lunch, dinner, but basically lunch. After lunch, you can take Ghritapan, 2 spoons of the medicated or simple cow's ghee. Then Shiro Virechana. What is Shiro Virechana? Nasya. Remember, Shiro Virechana, Nasya. Kaya Virechana, Upanaha, potis, and Sechana, sprinkling of the milk or sprinkling of the medicines. Okay, so this is all about this page, and now I will go for third page. So with your kind permission, I can move on the left side first, and then we will come on the right. Okay. So my dear friends, here we are in the center, and I will talk now about Anantavat. Very interesting name. Anantavat. The vitiated all the 3 doshas, Vata, Pitta, Kapha, localized in the posterior aspect of neck here, and cause severe pain in the neck. Severe pain here. Here. Over eyes, brows, and here, above the ear, temple region. It is associated with tremors in the neck region, diseases of the eye, and locked jaw. Locked. I can open your mouth. Suppose doctor is asking me, open your mouth. I cannot extend. That is called as a locked jaw. It is typical feature of tetanus, Dhanurvat. Okay. Anantavat Chikitsa, you can do the Sira Moksha or Sira Vyadh. That is Rakta Mokshana Chikitsa. That is blood letting. This is Suryavarta Nashaka Chikitsa. What else you can do? What else? Just move ahead and let us see. Shirakampa Chikitsa. Vatagna, anti-vata, Siddha Sneha, Svedana, and Katafala Tvak Churna Nasya. Katfal, tvak, skin. Tvak Churna, fine powder, Nasya. Like for example, Pradhaman Nasya. Or you can make some drops. But Churna is always Pradhaman Nasya. Dry powder blowing into the nostrils. Very irritating. Be careful. I am going little bit up. These are the types of Nasya. Navana Nasya, Avapidana Nasya, Nhapana Nasya, Dhuma Nasya, and Pratimarsha Nasya. Pratimarsha Nasya is very easy to do easy to perform, easy to accept. So Pratimarshanasya I like very much. Very much. Marsha and Pratimarsha. For this is a prevention is better than cure. If you want to prevent these head, what you can say, the ENT problems and head problems and ophthalmic problems, Pratimarshanasya. To prevent the dementia, loss of memory, to prevent the Alzheimer, to prevent the Parkinsonism, to prevent the motor neuron disease. Pratimarsha, simple cow's ghee, 2 drops here, 2 drops here, that's it. Pratimarsha. Navananasya, medicated oil, is instilled in nostril, that is nasal drops. Avapidana, medicaments, that is the medicines, is squeezed from the kalk of dravya. Kalk, nimbapatra swarasa, that is avapidanasya. Dhapananasya, medicated powder is inhaled through the nostril. Dhumanasya, medicated smoke is inhaled through the nostril. And Pratimarshanasya, medicated oil, only 2 bindu or 2 drops. Okay. Now, we will try to move on the right side of the screen and let us see what type of information still we can take it from these notes. Just I will try to move. Okay. Yes. Ardhava Vedak. Okay. Okay. I think I have discussed this point. Shankhak, Ardhava Vedak and Suryavarta finished. Now next page. On the basis of action. So here we are also learning about Nasya types, classification of Nasya. First is a Rechana Nasya, then Tarpana Nasya, and then Shamana Nasya. Rechana is removing the doshas, Prakupita dosha, removing Prakupita dosha, Rechana, like Pradhaman Nasya or Shodhana Nasya. These are the Rechana. What is Rechana? To remove the toxins, Ama, Tridosha, Prakupita dosha, we have to remove. Rechana from the nose. Tarpana, to giving nourishment. To giving nourishment to the nasal mucosa and all these organs. And Shamana Chikitsa, that is palliative, cooling down, calming down type of the treatment. Okay. So this was the things that I had given you as a type of the screen and the discussion. And now only audio will be there. And I will dictate you some of the important things from chapter number 8 and chapter number 9. Just slight 1 minute pause. Make an end line. Give the big title, chapter 8. More notes. Dictation. Chapter 8. What is that chapter? I think better I should go on that chapter. No? That will be better for you. This is a better for you. When I move up and open that particular part, so it will be very easy to understand what Dr. Deshpande additional information is given. I am talking about this chapter. Okay. Prasrita, Yogi, ya Siddhi. And here you have seen that there are different bastis. I am going to give the contents from this particular basti. So, why the name is that Prasruta Yogiya? Because all the quantities of the different bastis are explained on the basis of one Prasruta. So they have explained Chatur Prasrutika, Pancha Prasrutika, Shadatikta Pranchatika, Shad Prasrutika, Sapta Prasrutika, and Ashta Prasrutika. So one Prasrut 100 ml, Ashta Prasruta 800 ml. Okay. So this is basically given all this type of basti for Sukumara patient and who are exhausted. By the Sukumara word, what is Sukumara? Number 1, children, write down. Very old people, ladies, female gender, pregnant woman, okay, and very rich people who don't have any time for even exercise, and they are only having overweight at some times and having a very delicate personalities because they don't tolerate too much heat, too much wind, etc. Okay. Then the people who are laborer, daily walking a long time, they are doing a very hard work physically, then they can be getting benefited by this type of the basti. Here you write down Pancha Prasrutika Basti. Huh? I am going to tell you important contents. Important contents. Write down. Pancha, which one? Here. Can you see the cursor, my dear friends? Pancha Prasrutika Basti. Can you see mark? I have marked. So write down. Milk is there. Milk. 200 ml. Write down 200 ml. That is 2 prasruta. Then there is a mud. 100 ml. Tilatail. Tilatail. 100 ml. Okay. And cow's ghee. 100 ml. So it is all churned by the our churning machine, and it is given as a basti. So as here written, it is best for the vata vikar, physical strength, and color and complexion of the skin. Okay. Next is actually here in between they have written Ashta Prasrutika Basti. I don't know here. Yes, we have the Ashta Prasrutika. So write down the important contents. Please write down. Shall I mark there? Okay, I will try to mark. No problem. Because we have the time. Can you write down Ashta Prasrutika? Ashta Prasrutika contents. Tila Taila. I am giving you very common, not all. Then Mad. So every time you can write down Mad, Tila Tail, etc. Because these are Niruha Bastis. You know that there are two main types of basti. Anuvasana, only oil. Anuvasan basti, only oil. And another is a niruha, that is oil plus decoction plus pest, kvat, kalka, oil, all. That is niruha basti, or you remember another name? Asthapana basti. Don't forget, Asthapana basti. So we are discussing Ashta Prasrutika. Which contents you have written? Tilatail, okay, mud, honey, ghee, and most important is Dashamula Kvat. 10 roots, very important, Dashamularishta, most popular for arthritis. You can prescribe everybody. Dashamularishta. So that is there in Ashta Prasrutika. Okay. And also there is a Kulath Kvat. Please write down Kulit in Marathi. Kulath. Latin name horse gram. Write down horse gram. So it's Ushnavirya, remember. So it is anti-vata. Okay. Then there is a Nava Prasrutika Basti. Here it is not, but write down Nava Prasrutika Basti. Please write down. It is also for Vata Vikar, musculoskeletal and neurological problems. So here the Bruhat Panchamula Kvat, mud, honey as usual, ghee as usual. Okay. Then we will go further, which I can tell you. I think I have discussed to you about Panchatikta, I have discussed, then Shat Prasrutika, I have discussed. Then also Sapta Prasrutika, I have discussed. Huh? Okay. Then in the shlok number 15, shlok number rather 1670, write down 1670. There is a Gudadah Chikitsa. Gudadah, write down, burning of the anorectal region. Then oral treatment is given. Write down Drakshadi Kvat, Draksha, Kvat, decoction, plus Nishottara Kalka. Nishottara Kalka. This is for oral, not basti. This is Pitta Shamaka. Pitta Shamak is there. Next, there is a treatment for Amaja Shula. When there is Ama, indigestion is there, Amaja Shula. Amaja Shula. There is specific Kadha or the Kvat is there, Amaja Shula. What are the contents? Write down Ativisha, Kushtha, Tagar, Devadaru, Ativisha, Kushtha, Tagar, Devadaru, and Vekhand. Prepare the kada and give them orally. For what? For the Amaja Shula Chikitsa. Don't forget this word, Amaja Shula. Then there is a description of different Basti types. Different Atisar. Please write down. Atisar is the loose motions. Shlok number 20 onwards. Write down 20 and above. 21, 22, 23. Vagare. So that is the Atisar. Different types of Atisar. Why this is happening? This is a complication of Basti. Please write down. Basti Vyapad. If your Basti is not proper, then loose motions will start. And what are the different types? Please write down. Amatisar with Ama. Mal Atisar, Malatisar. Vatatisar, Pittatisar, Kaphatisar, and Raktatisar. Okay? But totally, Charak has explained in this chapter total 36 types of Atisar. Write down. 36 types of Atisar. And write down the shlok number 21. Shlok number 21. We are discussing Charak Kalpasthan chapter 8. Okay. So I have told you about the Atisar. Then because of the Atisar, again complication can take place. And that is Udarashul, pain in abdomen. Then Parikartika, that is fissure in ano, Parikartika. Jvara, Trishna, fever and heat in the body because of the complication of Atisar. Some important treatments of different Atisar. First is Amatisar. Write down Amatisar. Here you give the Antarapan. A typical word is there, shlok number 23. Please write down shlok number 23. Amatisara Chikitsa. Am Atisara. Then there is Antarapan. Antarapan. Typical word in shlok number 23. What are the contents of Basti Dravya? Sundh, ginger. Pimpri and Mire. Amla Dravya and Sandhav. So these are the contents where you can give this particular mishran orally. Remember, this is for orally. Oral, remember. It is not Basti, it is oral. Then next is Raktatisar. Please write down. For Raktatisar, they have said, Charak has said, give the Rakta Basti. Take the blood from the animal and give it to the human being by after purification, after filtration. So Rakta Basti. When I use the word Rakta Basti, I always admire one of the great Vaidya from the Dombivali part of Mumbai. Are you writing down? Write down. Famous Vaidya, I am telling you the reference, who has done a lot of practice of giving the Rakta Basti Chikitsa. Rakta Basti Chikitsa, not given by many Vaidyas, no. But in Bombay, in the region of Dombivali, there is a Vaidya Velankar. Vaidya Velankar. Don't forget this name, my dear friends. Vaidya Velankar. I can tell you the spelling. Velankar. You can search here and there, find out the number and call him. Sir, Dr. Deshpande on YouTube was telling your name. Rakta Basti Chikitsa, Vaidya Velankar, Dombivali, Bombay. And you can phone him and make him congratulations and learn Rakta Basti from Vaidya Velankara, Mumbai. Okay. Then just I am finding out if anybody interesting thing for you. Okay. Then there is different types of what you can Sarva Atisara Nashak Ghrita was mentioned by Charaka. Sarva Atisara Nashaka Ghrita. Please write down shlok number 36 to 42. Shlok number 36 to 42. If any question is there, you can search over there. Now I will try to see any important thing in chapter number 9. So I think I should take the screen on the right side. Am I right? Because still 7 minutes we have in our hand. Sir is very sharp in timing and starts in the time and closes in the time. Now I am trying to find out any interesting thing in chapter number 9, 3 marmiya adhyay. Actually, you write down in Charaka Chikitsa Sthan. This is not Chikitsa, this is Siddhi Sthan. But in Chikitsa Sthan, write down Charak Chikitsa Sthan, chapter 26. Chapter 26, 3 marmiya chikitsita adhyay. 3 marmiya chikitsita adhyay. That was Chikitsa Sthan, but the name is very similar. Here 3 marmiya Siddhi, that is 3 marmiya chikitsa. Okay. There he has mentioned Basti, Hridaya and Shira, 3 marmas. Huh? There he has mentioned some diseases and their management. Here he has added, Charak has added some more diseases. Totally in our body, there are 107 marmas. Write down number 107. 107. And if these particular spaces are hurt by trauma or by surgery, they get irritated, the organs. Now, next we will try to find out any important things. Then he discussed about the Hridaya. He says that Hridaya Pradesh, there are 10 dhamani in the heart region, 10 dhamani, that aorta and their branches. Pranavayu is there, Udanavayu is there, Mana, Buddhi, Chetana and Sukshma Mahabhuta, they are there. But here you can consider chest, heart and also maybe the brain. Okay. Then Basti Pariche, he has given the Basti Pariche. And next he has talked about Marmaraksha Mahatva. For example, in the shloka number, please write down shloka number 6, chapter number 9, Siddhi Sthan. He has given the symptoms due to trauma to the Hridaya, trauma to the Shira, and trauma to the Basti. Aghat. Aghat is trauma. So, Hridaya, Marma, Aghat, what symptoms you will get? There will be kas and shwas, breathless, difficulty in breathing, maybe little bit cough. Then Mukha and Talu Shosh, Apasmar, convulsions, and Saudnyanash. Some symptoms are related with the brain also. Personally, I feel. Then Shiro Marma Aghata Lakshan, head region. First is the Ardita, facial palsy. Ardita Vyadhi will be there. Then there also will be Moha, confusion, Cheshta Nash, loss of motor activities will be there. Then there will be Mukha Vakrata that we have already seen. Now, third point is Basti Marma Aghat. What will happen? There Malamutra Avarodh, obstruction to the urination and defecation. Then pain in the region of urethra and urinary bladder. So this type of the symptoms he has mentioned: Hridaya Marma Aghat, Shiro Marma Aghat, and Basti Marma Aghat. Okay. Then he has also described in shlok number 8 the Hridaya Marma Aghat Chikitsa, Shiro Marma Aghat Chikitsa, and Basti Marma Aghat Chikitsa. Management is also given. So in Hridaya Marma Aghat, he said any lavana, salt from the Pancha Lavana, then idlimbu ras, mix it together, and they give the chatana. So it will remove the gases and pressure on the heart will be relieved. So this Hingu Churna, because we have to take the Hingu Churna plus Pancha Lavana and with idlimbu ras. So this can Churna and Lavana can be given with the Laghu Panchamula Kvatha. Okay. Then in Shiro Marmagat, second point, Shiro Marmagat, then you can do the Abhyanga, oil massage, which is Vatahara oil, fermentation, Svedana, Upanaha, otis, snehapan, then nasya, and dhumapan. Then basti, marmaghat, chikitsa. Here the Charak is mentioning that you take some plants, for example, shama, and make a decoction, mixed gomutra, and give the basti. Okay. Then he said, Devadaru Siddha Tilatail Anuvasana can be given. Devadaru is the name of the plant which is mixed with the Tilatail, and Anuvasana can be given. Or Devadaru Siddha Tilatail. I'm sorry, Devadaru Siddha Tilatail. Don't forget that. Okay. So Marmaraksha Vidhi he has mentioned. Then he said that Anukta Vishay Prastavana, that means slok number 10, Charak is saying that three marmiya chikitsa sthan, whichever the diseases that could not be explained, right now I am explaining those particular diseases. And we have seen here Apatantraka Vyadhi. Then we have also seen the Tandra Lakshana. You remember this Tandra Lakshana. Then we have seen the Mutra Dosha. There are different types of Mutra. There's a 13, write down the 13 number. 13 Mutra Doshas are there. Okay. And their chikitsa he has mentioned. Okay. Then Uttar Basti, that's something from the Uttar Basti we have discussed. I have already a video on the YouTube. You can check that particular video. We have also discussed Ardhava Vedak, Suryavarta. So I will not repeat those things. Anantavat. So he has this in the chapter number 9, all these things. Then lastly, he has explained about Nasya, Nasya Vidhi. Okay. And I think that is the whole thing. Nasya Paschat Karma, total Nasya he has explained in this chapter 9. Charak has explained. Okay. Kapha Dosha Nashaka Chikitsa, Timira Roga Chikitsa, Marsha and Pratimarshanasya Bhed, and Pradhamana. Just interesting one point, last point. Pradhamana, 3, Muchuti. Very interesting. Muchuti. That is a pinch. 3 pinch in Sanskrit. Muchuti. Muchuti. That can be given. I think this is all about today's lecture because it is already 4 o'clock. So I wish you all the best. Take care, and we will see on the Monday for in this evening Roga Nidana class. Thank you very much. All the best to you.